The beginning of Interfaith Coalition in 1981 was the beginning of Interfaith Community Health Center. That's when President Reagan was elected, and there was beginning to be a lot of cutbacks to programs for low-income people throughout the nation. A pastor, Don Clinton, who was a pastor of a Lutheran church, the idea came from him to form an interdenominational ecumenical organization that would pool resources and then direct them towards social justice, poverty issues, local poverty issues.
It's really an amazing story. It started as an idea of a group called the Interfaith Coalition. They looked at the community and said, what are the needs of our community? What things could we do to make a difference in this community?
And really saying, you know, we're not going to wait for the government to fix this. We locally can make a difference. And the first issue that was identified was the lack of medical care for low-income people in the community. So through that, a partnership was created between local congregations, the medical society in our community, and then Opportunity Council, which was the largest social action agency in our community. And those three agencies came together to provide what really was the beginning of a referral system to hook folks up that needed medical care with physicians in the community who would volunteer to see patients within their own practice.
But that was soon overwhelmed. That system was soon overwhelmed. The volunteer physicians were, you know, booked out with whatever their capacity was for who they could see, and they actually had started, gotten some dentists to be on board as well to start to see people. And so they came back together again and said, okay, so this is outgrown what can be managed. Let's start a clinic.
Those early years, it was basically just a referral network. And then in 1987, a first nurse practitioner was hired part-time, and so that was really the beginning of an actual facility.
Bonnie Sprague, who was the original nurse practitioner, she was a solo provider for 3 or 4 years. I was the third provider to come to the clinic. So when I started, there were 10 employees. There were 10 of us total in the little clinic on C Street, and a lot of volunteer support. There were family practice physicians that would come in for a half a day a month. So we had a conversation as a whole clinic, all 10 of us sat down with the question of, should we start to bill DSHS? Should we bill Medicaid and open our doors to that? So of course I think we had no idea what that meant, but we decided yes. And that was like a dramatic change then in being this little sliding fee clinic to starting to bill insurances. And phew.
And since then it's grown to, you know, over 100 employees, and including dental care and behavioral health care. And it's been wonderful having all of those services under one roof. Since I've been here, Interfaith Community Health Center has gone through quite a few significant financial and organizational struggles.
When we were a program of the Opportunity Council, we were not an independent clinic. We were just one of the programs providing health care. It's not a favorite memory. It was a difficult time, but we actually went back to our roots. We went back to the coalition to say, this is important. This clinic is important to us. We believe it's important to the community, and adding stability to it is really imperative.
We stepped forward and did some special fundraising events, recruited some board members that had really good expertise in development, and I helped to kind of strengthen the organization so that it was able to make it through those tough times and continue to grow. It's really, really exciting to see such a beautiful building, professional building. It's very nice in here. The staff is incredibly dedicated and committed. To have such a nice facility that can serve so many people. It's very, very rewarding to see how a germ of an idea out of concern has grown and flourished into something that is able to help. There's got to be at least over 100 patients that receive care every single day.
Good dental care can help in a lot of ways. People we see a lot are pregnant women, and good dental hygiene, good dental care is very important during the pregnancy, both for the health of the patient and the health of the baby. So if we can get the mom healthy and disease-free, there's less risk of them transmitting the caries or the decay to the baby. There are many health conditions that dentistry can affect. The adult population, generally the problems we see when they get to us most of the time are emergent problems. Pain relief issues, abscesses, infections. We do a lot of extractions. We extract teeth that are restorable because patients can't afford to get a root canal and a crown that totals a couple $1,000s. So we're generally adults. We're in the stage of getting rid of pain, giving them their options afterwards, and trying to get them healthier. There's still some of the population that don't have the education about baby bottle tooth decay. And just a couple weeks ago, I saw a kid come in and he was 2.5. I mean, he barely had his molars long enough to, get decay in him. I don't know how it could happen that fast, but he came in and had decay in almost every one of his teeth. And the mom and dad were somewhat clueless, about the whole baby bottle tooth decay issue. So luckily we have resources that we can send, kids out to pediatric dentists. We do pediatric dentistry, however, we don't do sedation. And a 2.5-year-old needs to be sedated. Most of the time it's not that they're just neglecting their kid, it's, they just didn't know. So when you see them each year and they come back and they have the same fillings they got originally and they don't have any more cavities, you at least helped them. Hopefully, long term, not having big issues down the road.
The dental program has a once-a-month program where they reach out to adults. And so a board member comes by the morning that the dentists are here with refreshments. The community cares and appreciates the support that you're giving to patients. So to be that community support in many ways is a role that we've had in the beginning and we've continued to have.
Another thing that the coalition has done is that we have a program called the Mental Health Partnership Project. Community therapists, local counselors, who basically volunteer their time to the clinic. I mean, what an amazing service to our patients through this community effort of us and the coalition and basically volunteer providers. One of the things that we've seen change over the years quite dramatically is how many patients who have what they call a comorbid condition. So not only do they have diabetes, but they also have depression, schizophrenia. Our behavioral health program has grown really in equal proportion to our medical program in trying to meet the needs of patients with those challenging conditions.
As director of Interfaith Coalition, I have a lot of opportunities to go out and talk about the programs that we support, including Interfaith Coalition at local congregations in our community. And every single time that I speak to a group, someone raises their hand and says, I'm a patient at Interfaith Community Health Center and I don't know what I would have done without it. Or my child, or my neighbor. What a diverse group of people in our community have been touched and provided care because the clinic has been here. And it's been a wonderful safety net in our community.
Interfaith plays a vital role in the community What has the most meaning to me is to have been witness to some of the patients that I've seen and what they've been able to do with their lives. I mean, to allow me to be a part of that, to be a part of their lives and their struggles and their growth has been an incredible honor.
We can't provide bridges and crowns and, you know, the definitive treatment, but we're doing the step that needs to be done to get the patient back to better health and hopefully back on their feet. We're the place people come when they have no place else to go. You know, really, a lot of these people do not have any other place to go, and we're their last and only stop.
Access to health care. That's been our mission, really, since the inception, is who doesn't have access and how can we help? How can we provide that group of people with access to the services that they need?
Everyone deserves quality health care, no matter what your insurance is, no matter what your income is, no matter where you are in your journey through life, that everyone deserves high quality care in a compassionate way.